Hello, let's discuss anatomy of the arm. Arm has the two compartment, interior compartment, okay, also called flexor compartment, and the posterior compartment, this one, which is also called extensor compartment. In the anatomy of the arm, we will discuss about the muscle of the arm, okay, muscles of the arm. Then we will talk about the nerve supply and the arterial supply. Okay, so let's discuss first the muscles of the arm. First we will discuss about the interior compartment muscle. Interior compartment has three muscles, BBC: biceps brachii muscle, second B is brachialis, and third C is coracobrachialis. So this muscle, which is present most superficially in the interior compartment, it is the biceps brachii muscle. Bi mean two, so it originates from the two head. This is the long head and this is the short head of the biceps brachii muscle. The long head originates from the supraglenoid tubercle of the scapula, while the short head originates from this process of the scapula, which is coracoid process. Okay, this muscle, biceps brachii muscle, originate through biceps brachii tendon on the radial tuberosity of the radius. Okay, while this is bicipital epineurosis. This is through the bicipital epineurosis, it inserted on the superficial fascia. Okay, so bicipital epineurosis and biceps brachii tendon, this is the insertion point of the biceps brachii muscle. It has two action. One is as it is the flexor compartment, so the flexor compartment will flexes the elbow joint. Okay, so it help in the flexion of the elbow joint, and the other function is supination of the flexed elbow. Okay, so the first function is flexion of the elbow joint. Okay, and the second function is, or action is, supination of the flexed elbow. Okay, the second muscle is this one. Okay, if we remove the biceps brachii, then we can see it. This is the brachialis muscle. Okay, so the second muscle is brachialis muscle. It originates from the shaft of the humerus, mid shaft of the humerus, and it inserted on the ulnar tuberosity. As it crosses the elbow joint, so its main action is the flexor of the elbow joint. Okay, so the brachialis is the main flexor of the elbow joint. The third muscle is this one, coracobrachialis. It is also shown in here. Okay, medial to the short head of the bicep brachii muscle. This is the coracobrachialis muscle. Okay, coracobrachialis muscle. This is coracobrachialis muscle. Just like the short head of bicep brachii, which originates from the coracoid process, the coracobrachialis also originates from the coracoid process, and it inserts on the mid shaft of the humerus. As it is not crossing the elbow joint, so it has no action on the elbow joint, but it flexes the shoulder joint. Okay, so it helps in the flexion of the shoulder joint. And the coracobrachialis, the bicep brachii, and brachialis muscle, all the muscle in this interior compartment are flexors. Okay, that's why the interior compartment is also called flexor compartment, and it is innervated by this muscle. Okay, this one, musculocutaneous nerve. It is one of the main branch of the lateral cord of the brachial plexus. Okay, so when it exit from the axilla and the brachial plexus, it pierces this muscle which is coracobrachialis. Then it goes travel down to the arm, and it become lateral, and then it continue as this nerve at the lateral side of the cubital fossa. Okay, and it travels down on the lateral side of the forearm as lateral cutaneous nerve of forearm or lateral antebrachial cutaneous nerve. It supply the cutaneous or skin on the lateral side of the forearm. So the lateral cutaneous nerve of forearm or lateral antebrachial cutaneous nerve is the continuation of the this nerve, which is musculocutaneous nerve. Musculocutaneous nerve in the forearm, it after it pierces the coracobrachialis muscle, it runs downward and it lies between the brachialis and biceps muscle. Okay, so if we remove the biceps, then we can see the musculocutaneous nerve, and at the level of the cubital fossa, it becomes the lateral cutaneous nerve of forearm, which supply the skin on the lateral surface or the lateral side of the forearm. Okay, so these are the muscle of the forearm. Muscle of the interior compartment of the arm. We are talking about the arm muscles or arm anatomy. Okay, the artery which supplies the arm region is this one. This is brachial artery. It is the continuation of the axillary artery. Okay, so this is axillary artery. Okay, axillary artery is the continuation of the subclavian artery, and when axillary artery reaches to the lower margin of the teres major muscle, then its name change into brachial artery. Okay, so the brachial artery gives arterial supply to the arm. Okay, and when the brachial artery reaches to the cubital fossa, it terminates into its two main branches. At the lateral side, it is radial artery, and on the medial side, it is ulnar artery. Okay, so the radial artery and ulnar artery are two terminal branches of the brachial artery. Okay, so this is about the interior compartment muscles. Okay, and its innervation. It is innervated by the musculocutaneous nerve, and musculocutaneous nerve arises from the lateral cord. Okay, lateral cord of the brachial plexus. It is one of the main branch. Okay, musculocutaneous nerve has root value of C5, C6, C7 because it arise from the lateral cord, and the lateral cord gives arise from the this interior division of the superior trunk and interior division of the middle trunk. So, okay, so these two trunks gives the interior division to form the lateral cord, and lateral cord has main branch which is musculocutaneous nerve, and it supplies the muscle of the arm, and then it continue as the lateral cutaneous nerve of forearm to supply the skin on the lateral side of the forearm. Now we will discuss the posterior compartment of the arm. Posterior compartment has just only muscle, which is triceps brachii muscle. Tri mean three, so it originate from it gets origin from three head: long head, lateral head, and the medial head. Okay, so here the two heads are shown. This is long head and this is lateral head, and deep to these there is medial head. Okay, so this is medial head, of the triceps brachii. This is long head, and this is the cut end of the lateral head. Okay, and deep to these there is this medial head of the triceps brachii muscle. Okay, so the main function of the triceps, it is it crosses the elbow joint, so it helps in the extension of the uh, elbow joint, sorry, elbow joint. Okay, so it helps, or its main action is extension of the elbow joint. That's why the posterior compartment muscle are also called extensor compartment. Okay, and the main nerve which supply or which innervate the posterior compartment muscle is radial nerve. Okay, so you can see this is radial nerve. Okay, this is radial nerve, and the radial nerve in the arm, it passes or travels in the radial groove that is present on the posterior aspect of the humerus. So it travels down in the arm, in the lateral in the radial groove of the humerus, and then it comes on the lateral side of the cubital fossa. Okay, so it is on the lateral side. Wait, I will show you the picture. Okay, so this is a radial nerve. Okay, yes, so this is, you can see this is the radial nerve passes on the posterior aspect of the arm in the radial groove, and then it becomes interior to come on the lateral side of this fossa, which is called cubital fossa, and then it divide into deep branch and superficial branch. Okay, so the radial nerve is the main nerve which innervates the triceps brachii muscle. Okay, and this is the only muscle which is present in the arm region. Okay, and the arterial supply is from the brachial artery. Okay, so the branch of the brachial artery, which is the main branch, is it is the deep profunda brachial artery. Okay, or profunda brachii artery. It is the deep branch of the brachial artery, and it supplies the posterior compartment of the arm. Okay, so this is about the arm and its muscle. Okay, this is the radial nerve which supply the posterior compartment of the arm, and it is one of the main branch of the posterior cord, and posterior cord originates from the posterior divisions of the superior, middle and inferior cords. Okay, so the posterior division of the superior cord trunk, the posterior division of the middle trunk, and posterior division of the inferior trunks, it combines to form the posterior cord. And the two main branches of the posterior cord, one is radial nerve with the root value of C5, C6, C7, C8 and T1, while the other branch is axillary nerve, the root value of which is C5 and C6. Okay, so this is about the radial nerve and its innervation to the triceps muscle. Okay, so now we will discuss about the fossa, which is present on the interior aspect of the elbow. So this is elbow joint. Okay, on the interior aspect of the elbow joint, there is this triangular space. Okay, triangular area which is called cubital fossa. So it is triangle. So first we will discuss about the its boundary. Okay, so it has this medial border. Okay, it has lateral border, it has apex and the base. The medial border of the cubital fossa is made by the medial border of the pronator teres muscle. Its lateral border is made by the medial border of this muscle, brachioradialis muscle. Base is formed by the imaginary line between the two condyles or two epicondyles of the humerus, lateral epicondyle and medial epicondyle, and the apex is formed by the meeting of these two muscle, pronator teres and brachioradialis. Okay, so about the boundaries, so you can see this is pronator teres muscle, this is brachioradialis muscle. Okay, the laterally it is bounded by the brachioradialis muscle, medially bounded by the pronator teres muscle. Base is formed by the imaginary line between two epicondyles, medial epicondyle and the other one is lateral epicondyle, and the apex is formed by the meeting points of the pronator teres and brachioradialis muscle. Okay, its roof is formed by the skin and superficial fascia, while the floor is formed by this bicipital epineurosis, the insertion point of the biceps brachii muscle. Okay, so I will just look at the skin and superficial fascia of the biceps brachii muscle. Cubital fossa. So in the superficial fascia of the cubital fossa, there is these veins. This is basilic vein on the medial side, and this one is cephalic vein on the lateral side, and these two veins are connected through median cubital vein. Okay, so the medial cubital vein, basilic vein and cephalic vein. This is basilic vein and this one is on the lateral side is cephalic vein. So these veins are located in the superficial fascia of the cubital fossa, while there are two nerves which are present in the superficial fascia of the cubital fossa. On the medial side is medial cutaneous nerve of forearm, while on the lateral side there is lateral cutaneous nerve of forearm. Okay, so this lateral cutaneous nerve of forearm, this one is the continuation of the musculocutaneous nerve. Okay, this medial cutaneous nerve of forearm, okay, it has interior branch and posterior branch. Okay, so these veins and nerves are located in the superficial fascia of the cubital fossa, which forms the roof of the cubital fossa. Okay, so the cubital fossa has medial border, okay, which is formed by this pronator teres muscle. This is pronator teres muscle. This muscle, which is brachioradialis muscle, okay, it forms the lateral border, while the base is formed by the imaginary line between two epicondyle, medial epicondyle and lateral epicondyle, and the apex is formed by the meeting point of these two muscles, pronator teres and brachioradialis muscle. Okay, the floor is formed by the bicipital epineurosis, while the roof is formed by the skin and the roof is formed by the skin and superficial fascia. Okay, now we will talk about the content from medial to lateral. Okay, so the most medial structure in the cubital fossa is this nerve, which is median nerve. Okay, so it is most medial structure. Then after the median nerve, there is brachial artery and its two branches. Okay, so in the cubital fossa there is brachial artery and its two terminal branches. This branch is lateral and this is medials. The medial branch is ulnar artery and the lateral branch is radial artery. So these are the two terminal branches of the brachial artery in the cubital fossa. So the lateral to the brachial artery there is this tendon, okay, the white color. This tendon is biceps brachii tendon, okay, and the most lateral structure is this one, okay. uh, this lateral cutaneous nerve of forearm, it is in the superficial fascia, but the most lateral structure I will show you. Okay, so the most lateral structure in the cubital fossa is radial nerve and its two terminal branches, deep branch and superficial branch. Okay, so the radial nerve is not shown here. This is lateral cutaneous nerve of forearm and it is present or located in the roof of the cubital fossa in the superficial fascia. Okay, so the main contents from medial to lateral, once again, this is median nerve, this is brachial artery and its two terminal branches, lateral radial artery, medial ulnar artery, okay, ulnar artery. And the the lateral to the brachial artery is this tendon, which is biceps tendon, and the most lateral structure in the cubital fossa is radial nerve. Okay, so once again, okay, so this is median nerve, okay, this one is median nerve, this is brachial artery. Its two terminal branches, ulnar artery and radial artery. Lateral to brachial artery is biceps brachii tendon, while the most lateral structure is radial nerve and its two branches, deep branch and superficial branch. Okay, so this is about the cubital fossa and the compartment of the arms. Okay,